Managing medication is a significant component of transitioning your loved one from the hospital to home safely. As a caregiver, there are many considerations to make with regard to medication, so if you're ever confused about the instructions or use of a prescription, please call your doctor or pharmacist before administering it. Patient safety is our number one concern, so please don't hesitate to reach out to us if you need clarification. Your loved one may have been taking certain medications before their admission to the hospital, and you may be discharged with changed or additional prescriptions as part of their aftercare plan. So be sure to have a clear understanding of what you'll be responsible for administering when you return home. It's important to know the name of each medication you are administering and the reason that it's being prescribed. Be sure you understand this so you can help the person you are caring for in recognizing their need for the prescription. Each prescription will have a dosage amount and number of doses to administer. Most medications are administered daily, but a few are taken weekly, so be sure to read the label carefully. It is easiest if you establish a morning, noon, midday, and evening routine and administer medicine at the same time each day. Only administer the dose that the physician ordered. Taking more medication than prescribed will not bring faster healing and is very dangerous to the body's system. Don't skip doses unless you are specifically instructed to by your physician. Always check with your doctor before stopping or changing medications. Certain meds must be reduced gradually, and you can pose health problems if they are stopped abruptly. If one dose is missed, resume a normal dosing schedule as soon as possible. If you miss more than one dose, call your doctor or pharmacist to talk about safely resuming the proper schedule. Be sure to read how you are to give each medication. Some require them to be taken on an empty stomach, while others are prescribed with food. Certain drugs are long-acting and cannot be crushed or mixed into applesauce or yogurt for dosing. If a prescription has the letters LA, SR, DC, or CR after its name, do not crush them. They must be swallowed whole to work properly. Read the label carefully and make notes on a separate piece of paper if it is helpful for you to track which doses to administer when. Certain over-the-counter medications can interact with or disrupt the effectiveness of prescription drugs. Be sure to consult with your doctor or pharmacist before taking any over-the-counter remedies, such as pain relievers, vitamins, cold medications, herbal supplements, laxatives, or antacids. Understand whether or not there are contraindications with prescriptions before making additions to a person's normal regimen. Prescriptions are intended to be used only by the person it is prescribed to. It is extremely unsafe for anyone else to take another's medication, so don't let anyone else try another person's medication for a similar illness or disease. You might want to consider having a lockbox for certain medications, particularly narcotics. Narcotic abuse has become an epidemic in our country, so safeguard anything that could be potentially harmful or tempting to another person. Store medications in a cool, dry place, away from children's reach. Certain meds need to be refrigerated, so be sure to read the labels carefully and store them accordingly. Bottles will be secured with safety caps. However, if the safety caps are difficult for you to negotiate, you can request an easy open top. If you are a caregiver responsible for administering multiple medications each day, you may want to consider using a pill organizer. If you do, distribute pills carefully and accurately into the organizer, and don't dispense more than 1 week at a time into the organizer. Most medications have some side effects, so be certain to ask your loved one how they are responding to their prescriptions. A person may experience dizziness, headache, nausea, weakness, or fatigue as common side effects, some that may diminish over time as the body adjusts to them. Be sure to read the prescription inserts about potential side effects and warnings of each prescription, so you are aware of certain things to watch for. If side effects become intolerable or persist, call your doctor for advice. Any drug can cause an allergic or unexpected reaction, even if it is one that has been taken before. Allergic reactions are not side effects. A person having an allergic reaction may develop hives, have difficulty breathing, or experience swelling of the throat and become serious rather quickly. If you see any of the signs, call your doctor immediately. If a reaction to a medication is severe, don't hesitate to call 911 to get emergency help. If, for any reason, your loved one stops a prescription on the advice of the doctor, discard the remainder of the bottle and never keep medications past their expiration date. If you suspect an accidental overdose, call 911 immediately. As a caregiver, make a list of all prescription and over-the-counter drugs that your loved one is taking and keep it with you at all times. Be sure they also have a copy in their purse or wallet in case of emergency. It might also be helpful to keep a list in a bedside table or a kitchen cupboard. Any doctor, hospital, or dentist should be aware of all the medications your loved one is taking, so be sure to bring the list to all medical appointments. As a caregiver, you have many factors to consider in transitioning your family member or friend from the hospital to home. We want to help you in every way possible, and one way we can do that is to fill all of your prescriptions here before a patient is discharged. Leaving the hospital with all of the necessary prescriptions can improve patient compliance in their medication regimen, so we encourage you to use this resource. We call it our Meds to Bed service, and by having all of your prescriptions filled before you leave, you can be assured of having the medication you need to keep your loved one on schedule. Ask your nurse about filling them before discharge, and we'll make sure you depart with all the necessary components. Our Griffin Hospital Pharmacy is located in the lobby of the hospital and is open every weekday and on Saturdays. Our pharmacy accepts most insurance plans, and we will bill your loved one's insurance on their behalf and collect a copay if one exists. For your convenience, we also have free delivery to home, so be sure to inquire if this service could be of benefit to you. We'll deliver medications in a timely manner right to your door. All you have to do is sign up, and we'll take care of the rest. The Griffin Pharmacy is closed evenings and on Sunday, but we do have a hospital pharmacist on staff 24 hours a day in our hospital pharmacy. If you have any questions outside of our retail store hours, please be sure to contact your nurse, and they will be able to reach our pharmacy department to answer questions 24 hours a day. And if you have a favorite pharmacist at your local drugstore, we'll also be happy to send your prescriptions there. Proper medication management is essential and can sometimes be overwhelming if you are managing a lot at once. Don't hesitate to ask help from another family member if the responsibility becomes too much. Practicing medication safety prevents accidental overdoses or missed doses from occurring, so handle this responsibility seriously. And remember, we are always here to help. You can reach us at our pharmacy at 203-732-1490, so call if you need us.